apart so I can see the X-ray briefly. So I'm going to go in there, I'm going to take my stylet out, and then I'm going to try and drive this through the bone, and it's going through relatively easily.
You can like feel it.
I don't go through it to my own finger. I've done that before. And that hurts.
Oh, you've gone through straight through?
Out.
Well, not out the skin, but out the other side of the bone. So I can actually see it just sticking out there, underneath the skin. So I'm going to wiggle it about a little bit.
So you know it's going right through that bone right there, so you can get some of what's inside of it?
Yes, exactly.
And then you're going to test it?
Exactly.
Oh, okay.
For pathologists to look at. So I'm going to, the young lady with the biopsy jar can open that for me.
Oh, don't spill.
Carefully open the jar. I'm going to take
How
this.
do you open it? Oh, there you go.
So you want to come over here and just hold it right about here. Hopefully, if it works, we're going to have a little core of tissue that comes out. See that little core? So we're going to do a few more of those because we want to take several samples.
So where do you want this? Just
You can just pop the lid back on again for a moment until we get the next one out. So there's our... How are we doing, Cindy? You okay?
sweet.
Oh, he's bleeding.
So same thing again. Yes, you can bleed. You okay there?
It's not a lot of blood. I thought there was going to be
So
a
we're
lot.
going to try and go through. This is...
It was like a shoot pole.
I can feel that going through a bone and
become a little high there. So the normal bone above that area is so dense, is so tough, that I will not be able to get through it with this. I would need what's called a trephine, which has teeth like a little saw to get through that. There's a little tiny bit of tissue, we can put that in later.
So is the dog fully like asleep now?
Pretty much, yes.
so she doesn't feel anything.
She had some pain meds earlier as well.
There's like a pause.
Usually a series of different drugs that are given to her to get them back to do the procedure. She'll be a little sore on it, but there won't be a lot of bomb.
Does it take a while for the bone to actually heal?
No, he's just kind of taking a biopsy of it, so as far as letting that area in there heal.
Because you're not taking a lot of it, like it's a little bit.
So are you holding the leg?
You really have to
Holding the
get
leg?
it.
The leg?
Bone's pretty tough stuff.
So you have to, yeah.
I've bent these needles before trying to do this.
And they say people who this is what we would use if they want to take a bone marrow biopsy. People who've had it done say the needle going in doesn't really hurt. It's when they're pulling the bone marrow out of the that it hurts.
Lovely.
Oh.
Yeah. I just feel bad for the
Okay,
dog.
you got another one? There's another core.
Oh, that looks so
We
cool.
want nice, we want nice.
So is that from right inside there?
Yeah.
Yes, yes, it's a core of the abnormal bone with biopsy. So
Yeah. Videotaping.
Can you tell that they're just in the middle of a biopsy? I'll give her. Can you call me back? Thanks.
Normally, how many samples would you need for this type of...
Well,
You turn it.
the more you take, the less likely you are.
It's hard to see.
So I usually like to take at least 3 or 4, sometimes as many as a dozen.
So how long does this usually take for to get these?
Sorry?
How long does it like usually like just take in general to do a biopsy?
15, 20 minutes.
So Kleenex?
See her distal femur?
I can't, but I can imagine.
She's got a... She came in this morning, I thought she was going to be crucial. She's only 6.
It looks so cool.
That in a minute. So I'm probably going to try and get maybe 2. We've got 3 in there?
Yeah. 3 good
I'd like to try and get at least 1, maybe 2 more.
Lucy? Oh, you can see
Do you
all
keep
weird,
going
huh?
through the same path, or do you make a
No,
new
I
path?
really want to try to take from different
Be careful it's
areas.
not tight.
Getting, so that,
Tip it to
again, I'm
this.
trying to make sure that I capture
It's not tight. So careful.
the area that's abnormal.
Yeah.
And the trouble is that in many of these tumours like this, there's bone, there's irritated and reactive bone around the tumour. If all you biopsy is the reactive bone, you don't have an answer. You just have, you know there's something there, but the bone itself, the tumour cells are not in it, and so they can't make that diagnosis. So that's what we want to avoid missing the tumour.
Yeah.
And just getting the abnormal, irritated bone around.
Do you have like a pattern that you're doing, or?
I guess what I'm trying to do is, based on what I see, I'm trying to take sort of 1 from each area, so 1 from the top, 1 from the middle, 1 from the bottom. So we've got 1 more, I think, after this. Here we go.
Open.
Wasn't quite so big. Let's do 1 more, and then I think we'll let the middle lady go.
You said it's all on video?
Yep.
What? Nice.
Thanks.
Are you looking?
No, I'm looking at the X-rays. I can spot YouTube.
Yeah, YouTube, that's a good one. Everything. Hey Marianne, can I see the little bottom? It's not too tight, so. Did you see it?
Here, it's open.
Can you crack the bone from like
Any which?
crack the bone?
It is possible. It is possible. I mean, for one thing, because of what's growing in the bone there, that bone is weak. That bone is at greater risk of fracturing than a normal bone. And certainly, I wouldn't expect from what I'm doing for that to happen, but it could. It's certainly not a normal bone anymore.
It's so weird.
Thank you, Dan. I think we're good.
I didn't notice them in there.
So we'll probably just put a outside, we could use one of your staples to close that up, but I think in this case we'll probably just put a band-aid on it. Oops, that's not what I wanted.
Do you have a YouTube account?
Yep.
Me too.
Look how clean that is now.
Alright, have you got a finger I can borrow? Just put a bit of pressure on that for me. Just need somebody to hold it for a few minutes.
Not in front of them. That's crazy.
Stop squeezing.
That was quick.
Yeah, that's quick. That was about 8 minutes and 18 seconds.
Yes, it doesn't really take very
21 seconds. 24 seconds.
I mean, different biopsies are differently involved. I mean, for example, if we're biopsying the spleen, it usually means we're opening up the abdomen and going in and taking it out, unless we're doing it with ultrasound guidance. Oh, there's a couple more pieces. Let's just pop those.
Hey,
Can I just pop
guys.
these last 2 in that jar? Sorry. If you can close it up, just give it a shake so they all end up in there.
but close it up a lot.
Yes.
And make it for a minute. Just take that off. If you want to push it again, that'd be great.
Got it. Now they're floating around everywhere in there. It's a good shot. Get it. There you go.
Did you just say 8 or 9 years old? That's 9 years old.
Really? 29 minutes and 29 seconds.